That's there. We're joined by Dr Larisa Corder. She's here to answer your fertility questions this morning. Dr Larisa, really lovely to see you. I want to get straight on to the cause because so many people are suffering and having problems out there who want to talk to you. So let's go straight to Jill. Hello, Jill. Jill, you there?
Yes, hello.
Hello, Jill. Hi. So Dr Larisa is waiting to talk to you. What do you want to ask her and talk to her about?
Basically, I've started my first cycle and my scan and blood tests show that the follicles are not growing as well as they'd like. So potentially I might need to end this cycle and just start another one. And I wanted to ask, what could I do to improve my success rate should I need to start another cycle?
Well, of course, Jill's talking about an IVF cycle here. She's having injections, and Larisa, as we understand it, she's using, obviously, she's using the sperm donors for this. So over to you.
Yeah, so as you said, context to this, Jill, you're 41, you're going through an IVF clinic to do your IVF, and you're using a regulated sperm donor, which is really good because it means the sperm will have been screened and it's going to be the best quality sperm that you can get. It would have undergone all of the tests and been screened for any possible infections that might present a risk to you. Now, with regards to your question about what you can do to help improve your chances, I love this question, and we've covered it a lot of times in the programme before, but specifically in terms of IVF, what I just want to explain a little bit about is with regards to being age 40 and above. So we know that when you're born with the biggest number of eggs that you're ever going to have, and then over time, those eggs start to decline in quality and also in quantity, and that's just through some of the sustained DNA damage that happens with aging. So in terms of improving your chances, what we're talking about here is increasing the number of follicles or eggs, which is quite difficult to do when your reserve is quite low. And generally speaking, when I do IVF for anyone, I do recommend that they have milder protocols to help with that. But that's something you can discuss with your clinician, and in the clinic where you're at, there might be some changes that can be made. But what we're really addressing here is the quality of those eggs. Now, that can be quite difficult to do because, as I've just said, you're kind of born with these eggs and then they undergo some changes that occur as you age as well. However, this new science of epigenetics, which I'm really, really excited about, is all about how we change our external environment and internal environment to try and optimize the quality of our eggs, sperm if you're a man, and also that uterine environment. So it's everything I always bang on about with regards to nutrition, cleaning up what you're eating, improving your diet, making sure you're exercising, improving the blood flow to your ovaries and to your womb as well, making sure you're looking at stress outside of your life. So what is it that's increasing your stress levels? Because this can have a much bigger impact than we think. And then looking at any toxins that might possibly also be affecting your chances of getting pregnant. So for more details, because I know we've had so many calls in and I want to try and get through as many questions as possible. If you want any more advice on this, please go on This Morning YouTube. It's all in the conception plan and we talk about this in a lot more detail. But those are just some basic tips to try and help your chances. And I wish you all the best. It's only one cycle.
Yeah, Jill, we do wish you best. And I think that obviously will cover, a lot of people's questions about if that, how can they kind of increase their success rate.
And topically, the vaccine's coming into play.
Yeah, let's go to Alice because she's got a question about the vaccine. Hello, Alice.
Hello.
Hello,
morning.
What would you like to ask Dr Corder?
Hi, so my question is, I've actually been invited to have the COVID-19 vaccine, but I do have questions around or concerns that could affect fertility. So I already suffer with endometriosis, so will likely find it harder to fall pregnant anyway. Could the vaccine have a further effect on this, or is there any research out there on this?
Great question, and I'm so glad, Alice, that you called in about this. So there's a lot of confusion about this vaccine, which I'm going to tackle in a second. But with regards to your endometriosis, this is a chronic condition. Eamonn and Ruth, we spoke about this last time when we did a segment on it. Essentially, from what we think so far, endometriosis does not increase your chances of getting more severe disease with COVID. But if you are someone who's affected by what we call thoracic endometriosis, the endometriosis in your lungs, then that is something that might increase your chances. And you have had that invite to have the vaccine for a reason. So I think it's really important to address that and to get the vaccine if you've been offered that. Now, with regards to the advice for the vaccine, there's a lot of discord between the Americans here, the Europeans, and the British Fertility Society. So the Americans are saying it's fine and it's safe. The Europeans are holding back in terms of their advice simply because we've not done any active studies on women who are pregnant and those trying to be pregnant yet. But those studies have started, as they have on children. So far, from what we know, the advice and the data that we have, which has been done on pregnant women, is really, really reassuring. So even if you were to get COVID whilst you're trying to get pregnant, the chances are it will just be a milder form of disease. And we know that it doesn't cause any significant impact on babies and mothers. But it is important to have if you are planning a pregnancy, because you may develop more serious disease, as is vaccination for your partner, so he's not a risk to you. So what the British Fertility Society is recommended is if you are planning to get pregnant, then go ahead, have the vaccine. It doesn't matter if you're trying naturally or you're trying with IVF. If you get any potential side effects, so things such as a fever or you're not feeling well, obviously, hold off for a few days. I mean, I'm sure you're not going to feel like trying for a baby during those couple of days as well. Let everything settle down, the immune system settle back down. But we think so far from the data that we have that it is safe, it is okay. We're not expecting any harmful effects, and hopefully that's going to reassure a lot of people. But what we're really looking for now is this global consensus between the Americans, the Europeans.
We want to go from the vaccine now, Doctor, to COVID itself. This is Lorraine, and your concern about COVID is what, Lorraine?
Yes, morning. So I'm on month 3 of 6 on my Clomid treatment, which is a medication that makes me ovulate. My husband and I both had COVID at the end of last year, and there's now research saying that COVID can affect male fertility, mainly the sperm morphology. So we're wondering, should he be pushing to have his semen analysis redone, and should I pause my medication, and is there any sort of recovery time for him? Because if this doesn't work, our next step is IVF, and we spoke to our fertility nurse, and all she could say is there's just not enough research currently for her to advise us.
Doctor, as quick as possible, please. We're out of time.
So another really great question. You've both had COVID quite a while ago, so you should both be fine and recovered from that. In terms of the effect on sperm, there's been loads of ongoing research into this, which is still very active. But we do know overall that it doesn't have any long-term effects on sperm. It doesn't increase any chances of abnormalities. It's a good idea, definitely, to have a repeat semen analysis to make sure everything's gone back to normal, in particular with regards to sperm count, because having a fever, which is a common side effect of COVID, can impact those numbers. So in short, as long as the semen analysis is normal, go ahead, start your treatment, have the Clomid, and good luck.
Thank you, Doctor. Thank you very much, Lorraine.
Thank you very much, Lorraine.
Well.
I hope that's put your mind at ease. So many calls there. I'm sure we'll come back to this one because literally so many people waiting to talk to you. But as Eamonn said, sadly, we're out of time on that one.